Welcome back. Graft versus host disease, or GVHD, is a rare disease that commonly impacts allogeneic blood and marrow transplants recipients. Living with GVHD can be overwhelming for patients as well as their caregivers and family. So joining us now to bring awareness to this rare condition is Dr. Cutler and GVHD patient Meredith Cowden. Hi guys, thank you so much for being here.
Thanks for having us.
No problem. We're so happy to bring awareness to something like this. Dr. Cutler, can you tell us what is graft versus host disease?
So graft versus host disease is a medical complication of stem cell transplantation. In stem cell transplant, we transplant a new immune system into the recipients. That's part of the therapy. And that immune system can recognize the body it's now living in as foreign and try to reject it. So graft versus host disease is really the equivalent of rejection after a bone marrow transplant.
Wow. So who does this disease impact? Is it only bone marrow transplant recipients?
That's correct. So individuals who receive a transplant from another individual are potentially affected, although not all are affected by the disease.
Okay, Meredith, tell us a little bit about your journey with GVHD.
Yeah, so it started when I was 19. I developed leukemia, and then the best course of treatment for me was a bone marrow transplant. So, and then shortly after the transplant, I developed acute graft versus host disease and then chronic graft versus host disease. And so, it started out kind of like it was a rash and it burned. I was really red. And then over the years, I've had it for a little over 20 years now, and it's manifested in various different ways throughout my body. It's affected my eyes, my mouth, my stomach, my kidneys. Now it's really impacting my lungs quite a bit and my musculoskeletal system. So it's really, you never really know what to expect with it. And it's something that is pretty, surprising at times. Yeah.
Well, we're so happy to have you guys here to talk about this. But Meredith, what would you say is the best way to advocate for someone with this disease?
It's finding the resources. It's finding the resources, and the best place that you can do that, I would say, is the GVHD Alliance website. It's gvhdalliance.org. There you can find resources for patients, caregivers, community health providers, lots of people, and lots of great information.
That's amazing. Dr. Cutler, what can you tell us is the major takeaway that you want people to remember about this condition, like the one standout thing if we had to pick one?
Our main message today is really about GVHD. On February 17th, we're bringing together the entire community to raise awareness about the day and to really empower our patients to learn about their disease, to bring it to the attention of their physicians so that we can treat it early and treat it more effectively.
I love that. Well, thank you so much to both of you for being here. I really appreciate you stopping by and allowing us to shed a light on this rare condition. We thank you so much.
Thanks for having us.